triage nurse went to the restroom to see what was going on.
Baby. The infant was completely blue. She showed almost no signs of life, the nurse explained, with a shaking voice that the baby had been found inside a toilet. The umbilical cord had just been cut, and the mother had disappeared. Andy checked for a pulse, and the heart rate was only 60. Far below normal, meaning the organs were already shutting down. Another problem quickly appeared, however. The baby was unbelievably tiny. Even the smallest intubation tube he could find was still too large. There were no other options. The tube had to go directly into the trachea, or the baby would die staring into the infant's throat. He couldn't even see the vocal cords clearly. One mistake into the esophagus, and she would die instantly. Andy forcefully lifted the laryngoscope. The movement itself could injure the baby, but without it, she definitely would not survive. Finally, the vocal cords came into view, and the tube was successfully inserted into the trachea. But the emergency still was not over. She was too tiny for IV access. Her veins were impossible to catheterize. Andy had no choice but to use the most dangerous option, injecting epinephrine directly into the lungs.
Okay, we're gonna have to give it straight through the ET tube into the lungs.
This procedure was normally forbidden. The liquid could block the alveoli, and she could permanently lose the ability to breathe. Everyone's eyes stayed fixed on the monitor as the numbers climbed 60. 120, the baby had come back to life, and the baby was taken to intensive care. Who would throw a newborn into a toilet? Could this tiny baby who almost died actually survive?
Comment 777 for the next episode.
If I drop his arm and his hand magically misses his face, well then he's faking. I've never seen that many officers escorting a prisoner.
George is an extremely dangerous prisoner. He'd been lying motionless on the bed for 5 hours straight. The police suspected he was faking unconsciousness.
Personally, I think he's faking it.
And 3 officers kept a constant watch on him. Escape was practically impossible. The doctor began examining George. On the surface, his vital signs seemed completely normal. His pupils also reacted normally, which ruled out a brain hemorrhage or drug overdose. To confirm whether he was only pretending, the doctor did a sternal rub test. The pain from rubbing the breastbone would make anyone who's conscious scream out, but George didn't react at all. That strongly suggested he was truly unconscious.
And then I need to figure out what might actually be wrong with him.
The doctor grew worried about what was really wrong with him. Maybe he wasn't faking it after all. To make sure and prepare for a CT scan, the doctor convinced the police to remove George's handcuffs and leg restraints. A few minutes later, the CT technician rushed out in a panic, calling for police backup because George had woken up suddenly.
Handcuffs so we could put him in the scanner. He came to.
Oh dear God.
Was an entire carpet of thousands of maggots.
The man's leg was crawling with maggots, and even the doctor was startled when he saw it. He had no idea what this man had been through. The man's name was Thatcher. Thatcher had actually been in the air just last week, but this time, the doctor pushed the case straight onto the intern, and the intern knew right away that he had been handed the dirty work again. The intern figured Thatcher probably just had cellulitis or maybe gangrene, but when the intern looked down at that boot, he almost could not hold it together. From Thatcher's toes all the way up to the lower part of his calf, the leg was covered in maggots. The intern had no idea what had happened to this man. The doctor tried not to gag and ask Thatcher how long it had been like this, but Thatcher was strangely calm. He said about 4 or 5 days and that it did not hurt. At that point, the doctor was breaking down on the inside. The doctor first had to see what the wound underneath actually looked like. But right now, maggots and dirt were covering everything, so there was no way to judge it. So the doctor had no choice but to send Thatcher with the nurses for a shower, so they could slowly wash everything off his leg. Everyone knew the air had a maggot patient. At first, the intern thought he was the unlucky one. But when he saw the nurses washing Thatcher's foot, he actually felt a little better.
It's funny.
You want to see funny?
Better. Because now he was not the only one who had to suffer through it. More than an hour later, Thatcher was wheeled back in, and the doctor almost did not recognize him. But what really surprised the doctor was the leg. He had expected the tissue underneath to be badly rotted, but once the maggots were washed away, the wound looked strangely clean. It did not look like a severe infection at all. So why would that happen?
There was a spoon stuck in the pot, and I just started stirring it around and...
Right after the meal, 3 members of the family were rushed into the ER for emergency treatment, and the doctors suspected poisoning. The moment the mother heard that, she broke down in tears. Before long, the doctor had the trash can from the house brought into the ER, and everyone immediately started digging through it.
Did you put anything new in it this time?
No. You think my stew did this?
According to the mother, the family had been eating together that evening. Before long, both of her children started vomiting, and a few minutes later she collapsed on the couch herself. Realizing something was seriously wrong, she quickly had them taken to the ER. At first, the mother thought maybe the family had just gotten sick from something they ate. After all, they had been in the middle of a meal. but the doctor immediately knew something did not add up. If this had just been something they ate, how could all three of them get sick at the same time? And it happened way too fast. That made no sense. The doctor started to suspect food poisoning. Then he got in touch with poison control. But poison control quickly ruled out ordinary food poisoning first. The reason was simple. These people had gotten sick too fast, and they had all started feeling bad almost at the same time. If it had just been bad food, the symptoms should have come on more gradually. And when poisoning shows up this fast,
This whole secret blend that she puts into her stew.
home, the only things he had done were grab a cheese sandwich and eat a bowl of the mother's homemade stew, which meant the father had not stayed in the room after eating at all. By that point, the doctor concluded that this had to be food poisoning, but that stew had been made by the grandmother. It was her signature dish. So how could it possibly have poisoned the whole family?